Dr. Unger is here today to talk about the surgical options for treating hair loss. Dr. Unger, when should a patient consider a surgical treatment for hair loss?
Basically, either when they've tried or are not willing to try the conservative methods that we talked about last day, or alternately when they just see too much hair being lost every day. Medically, we're concerned if there's more than 100 hairs a day, but most people aren't going to count. They just see too many.
And how do you surgically treat people?
Well, basically, we treat them with hair transplantation or scalp reduction surgery. Hair transplantation is moving hair from the U-shaped area peripherally to the dorsum of the head.
I see some people that have just a little bit of hair loss at the front top. Can you treat just that small baldness in women that you see, for instance?
Yes, you can. You can treat any area.
With the same treatment?
Exactly.
And you're taking it from the back of the head?
That's correct. And if they have a larger area in the mid-scalp or crown, men or women, that area can be made smaller by scalp reduction. It brings the hair from the sides, which is twice as thick as any transplanting can be, and gives a much better result overall.
So explain a scalp reduction. That's an incision. You're reducing the size of the scalp.
Precisely. You're removing areas of thinning hair or bald area and bringing in the thick hair from the side that is roughly 230 hairs per square centimeter.
And does that involve a hair transplant as well when you do the scalp reduction?
I'd always recommend a hair transplantation after the area is being made smaller.
And do you do that along the part line? So you've just got this perfect
We
part?
want to hide it, yes. We want to hide the incision at the margin of the hair pattern. Then we put grafts right along the scar so it virtually disappears in the future as well.
So when it comes to women, what if you've overplucked or you've had chicken pox or something in your eyebrows, you need to have a hair transplant, or you want more eyelashes? Can you get a hair transplant for that?
Yes, eyebrows and eyelashes can be done. About 3% of all transplants are done on eyebrows, about less than 1%. 0.35 or something like that on eyelashes.
And are those permanent?
Yes, they are. The one thing is that they do continue to grow, so you have to clip them on a regular basis, whereas our own eyelashes and eyebrows, we don't have to do that with.
So for male and female, if you are getting a hair transplant in an early stage, are you going to be chasing that hair transplant? Is it going to start to bald as you go back with your regular hair loss you would have?
For almost everyone, hair loss does progress, so they will have future hair loss. But sometimes we'll be lucky and they'll transplant an area and they have no further hair loss.
Yes.
So generally, it may be an ongoing thing, or you may be lucky and not have to do it again after.
So it's a permanent in the treatment, the area that's treated, it's permanent.
Correct.
However, you could have hair loss in the future that you were preconditioned to have.
Correct, progression of the hair loss. And normally 2 transplants is what I recommend in an area in order to have all of it grow successfully.
Thank you very much.
You're very welcome, my pleasure.
Do